Let's talk about implants. So going back, 15, 20 years ago, implants were only for the rich and famous. They were very expensive. They were hard to place. A lot of times you had to do it in the hospital setting. So things have changed over the last 15, 20 years where now it's affordable. We can do it right in our office. Easy techniques for us and easy for the patients, which is most important. And again, why are we here for an informational seminar? We want to make sure that not only our own patients, but other patients are informed of what their choices are and give them more information so they can make an educated decision on helping their needs. What we're going to talk about today is, I don't know if you have friends or family where they're missing some teeth, they have trouble smiling, they don't like to eat in front of you, they don't like to talk, their dentures or partials are come loose, and they're not comfortable in wearing something when they're missing teeth. So, what we want to do is talk about again with implants and how they can make you look 10 years younger, how they will help us keep teeth in the right position, keep them from shifting. Because once you lose a tooth, everything starts shifting on you. And with bone loss and teeth shifting, and that's how teeth start to break. So we want to emphasize how important it is to replace teeth, not only with implants, but with something so that you don't have problems as time goes on. And again, we're going to talk about how implants are a simple step to give you that beautiful smile again. Why partials are not a good long-term solution. It's okay for short-term, but why it's not a good long-term solution. Again, one size does not fit all. There are many different sizes of implants nowadays that solve many problems. And again, how we can get your smile back to where you feel comfortable with yourself again. All right, so the technology has never been better. Not only are the implants improving, but also the way we can place them. The procedures are easier, much easier for, again, like I said, for not only for us on our end, but also for the patients. Less time with having issues with pain or swelling. So it's never been better. When you lose a tooth, your mouth is in constant state of deterioration. So what that means is that when you lose a tooth, the bone starts to resorb right away. So we want to make sure that you realize that when a tooth is gone, you need to replace it with something. Otherwise, you start losing bone within a short period of time, within a couple of months. So if you wait too long, it gets very expensive. So as soon as you lose a tooth, that's when we talk about thinking about what we can do to replace it. And one thing why we've changed what Rauchberg Dental has done, over the years, there are good specialists in our area, but it always became where, Dr. Allen, where do I need to go? I'm missing a tooth, I need an implant, I need this, I need that. Why do I have to go to 5 different places to get the work that I need done? So, and patients were right. It made sense to bring our specialists into our office so that not only is it more convenient for patients, but the main issue is we just do a better job for them. If we can have all the specialists on staff, conferring with you right there, and it just makes everything go smoother. We're going to do a better job. We're all going to be there together, helping you make good decisions. It just makes sense to have everybody in one place. Missing teeth, what happens? It limits what we can eat. It's hard to eat anything crunchy, anything gooey when you're missing teeth. It affects how we live our lives both socially and emotionally. It affects our normal routine. We don't like talking, laughing, smiling. Really takes away your confidence. So we're going to talk about how implants can give you all that back. So let's talk about what happens when we lose teeth. So one of the first things that happens, just showing you a picture here, if you lose a tooth, teeth start to shift. Top tooth will start dropping down, teeth on each side will start caving in. We start having problems with your bite, teeth can break, lots of issues can happen. Again, changes in the bite. One of the biggest things that we're worried about is bone loss. So when you lose a tooth, within 6 months, you can lose 50% of that bone ridge that's in that area. So when a tooth is gone, the bone resorbs itself. It goes away, it shrinks. So our job is, we don't want that to happen. Not only is it because it changes not only your facial features and can lead to not only face collapse, wrinkles, and in extreme cases, nerve pain and jaw fractures. It affects, if we're going to replace it, how difficult it will be when we go to replace that. So the sooner we can get to replacing a missing tooth, the better. So we're missing teeth, reduces our chewing ability. You know, when you wear a denture or a partial, you just don't have the biting force that you once had with your own teeth. It's made out of, it's made out of acrylic, it's plastic. You just can't chew down hard. So again, that's why we're talking implants are our best solution. When you also have a partial denture, you don't chew the same foods. People are going to softer diets. They're chewing foods that are easier, they're mushier. You know, we want you to be able to eat those foods that you've been always able to eat. And again, that's where implants will give us that same biting force that we have with our own teeth. And studies show that people who are missing all or most of their teeth have an average lifespan of 10 years less. And a lot of that is due to poor nutrition. Again, we're eating starchy food, lots of carbohydrates, you know, diabetes issues, heart disease. There's a big correlation with what we can eat, what we do eat, and how we take care of ourselves. The great thing is now in dentistry, there are a lot of options for us to replace missing teeth. So the one option that is what we call standard of care now is dental implants. So we're going to talk about that for a minute. So just in case you're not sure what a dental implant is, this is a diagram of what an implant is. So it mimics what a tooth looks like. There's a titanium cylinder that gets placed right where your tooth was that acts just like the root of your tooth. And eventually we will put, if we're making a crown, the crown will go right on top of that. If it's something that will snap into, let's say a partial denture, then we can snap into that using our implant. But ideally, it would be great if we can put a titanium cylinder right where your tooth was, put a little, what we call a little abutment into that implant, a crown on top, and it looks just like your own tooth and acts just like it. Why are they considered standard of care? So the three main reasons, or I should say even four main reasons. One, we can stop the bone loss, and that's one of the biggest reasons. We stop tooth shifting, we increase your bite power to where you were originally, and we don't have to do anything to the adjacent teeth. With bridges, we have to cut those down. With partials, we're grabbing onto them, causing more stress. So again, implants would be the best solution for you. This is kind of a big word, isosseointegration. What that means is when that titanium cylinder is placed where your tooth is, the bone grabs around that titanium cylinder and grows around it and acts just like your own after about 2 or 3 months of healing. So it's hard. It's almost like concrete. It's not going anywhere. Once we place that implant's going to be there for the rest of your life. So that's just kind of when the implant and the bone integrate together, it's called osseointegration. So, you know, why are implants the right solution for you or me? Well, you know, there are many sizes. We can solve a lot of problems. So let's talk about some of those problems. So if you're missing one tooth, let's say it's in the front. So in the beginning, what was most popular was a partial. It solved the problem. Piece of plastic tooth, goes in your mouth, a couple of hooks around your remaining teeth, and at least it replaces that missing tooth. But the cons are very uncomfortable, irritates your gums and irritates the teeth that they're hooking onto. Shifts and moves around when you're eating, always getting food caught underneath, have to take it out and clean all the time. Those clasps that hold on to their teeth can wear those teeth down, cause issues with not only breaking teeth but also cavities. They need to be taken out at night. They don't last, they're made out of plastic, don't last for more than a couple of years. And again, unfortunately, that bone we continue to lose that bone where that tooth is missing. Solution number 2, another good way that's a little bit better is a bridge, what we call a fixed bridge. So what we have to do there is if you're missing, again, a front tooth, we have to reshape the teeth next to that missing space. Put a bridge which covers those teeth plus the missing tooth. This was a showing of 3 teeth. It works. It gets cemented in place. Can't say though it lasts forever. I got to cut those teeth next to that missing space. So now we've had good teeth and now we have to cut down. Unfortunately, we're still losing bone. We have better chewing forces there, but still not as good as your own. And again, the lifespan. We're talking maybe about 5, 10 years, 15 years at most, not lasting as long as we would like it to. Again, our standard of care is an implant. It goes in right where the tooth would be. That titanium cylinder acts just like our root of our tooth. Little abutment sticks out of their gum on top. The crown goes on top. It looks very natural. Gives us that chewing ability. Stops the bone loss. Gets cemented or screwed in. There's no taking anything in or out. Don't have to do anything to the adjacent teeth. Keep them healthy, easy to keep clean. Can't get a cavity on a titanium screw. That's great. Do have to keep the gums healthy, but we don't have to worry about the cavities. And it's our most secure and stable option. And again, when we place an implant, you can't tell nowadays if it's your own or not. That's how natural we can make them. The porcelains that we have now to work with are fantastic. They're very natural, very lifelike. They look great, and they work very well with biting and chewing. Now, several teeth missing. Let's go over those options. So the best way is what we call an implant bridge. If you're missing several teeth in the back or in front, we can place 2, 3 implants, have the remaining teeth crowns attached to those. We can get a long span there. Stops the bone loss when we replace those implants. Again, once in a lifetime solution. Very comfortable. You can eat anything that you want at that point. Same biting forces. Looks very natural. Strong, stable, functional. And again, they're screwed or cemented in. They don't come out. Some of the other options that we have also, if somebody is missing all their teeth, one way to solve that problem is implants, denture that snaps into implants. Now, it's not the most ideal, but it solves a lot of problems. We can snap into a denture, increases the stability, gives us better biting forces, lets that patient talk and eat naturally. You can a lot of times use your existing denture if you had one, so you can retrofit it. And it does solve a lot of problems. We still have some bone loss where those implants aren't, but sometimes for an older patient, and they don't have, let's say, sometimes the financial ability to do a mouthful of implants or have the bone support left and they're not able to do those surgical procedures, it's a good alternative solution to having a denture that just moves around all over the place when you eat, talk, and smile. And one of the last things we want to talk about are mini implants. So mini implants have just come along the last few years. They're made for those special cases where somebody cannot go through a surgical procedure, where there's limited amount of bone in an area. And again, it will give us some stability for a denture, top or bottom, where we need a little help where something, if their bone support has really decreased, it's just always moving around and they can't chew or eat or smile. So it's another way for us to get a little more stability and able to give somebody back their confidence. And again, reports are showing us success rates for implants have never been better, 98%. It all comes down to technique and the quality and what we have now with technology with our implants. Again, some of the questions that people ask, Dr. Rauchberg, does my insurance cover that? And there are some insurances that now cover some dental implant procedures. But also we have patients that will be able to use their FSA plans, flex plans. Sometimes they'll use their IRS checks. But there are ways we can help you make it affordable, and that's what we're trying to do for patients. We want to help. We're trying to help to solve problems, and thinking long range as best we can. And we're always trying to come up with ways to help them make it affordable so that it works within their budget. Again, for coming out tonight, we are offering, again, we appreciate everyone taking out that time out of your lives and coming to hear about our implants. But also, we are giving away a free office consultation with any necessary x-rays. And that way we can sit down and take a look and analyze and see what's going on with your situation and give you some good recommendations and hopefully solve some problems for you.